Hi, I am Dr. JP Silvera from TaylorMade Health and Wellness, and I want to tell you about a patient who walked through our doors 3 days after a rear-end collision feeling, in her words, completely fine. She had left the scene without a scratch. No ambulance, no ER visit, just exchanged insurance information and drove herself home. By day 2, she couldn't turn her head to check her blind spot. By day 3, she was waking up at 4 in the morning with a headache sitting right behind her eyes. Here is what most people don't understand about car accidents and why that story plays out in my office more often than almost anything else. The moment your car gets hit, your body does something remarkable. It floods your system with adrenaline. That surge is a survival mechanism. It is there to help you run, fight, or get yourself out of danger. And it is powerful enough to completely mask pain for hours, sometimes days. So the fact that you felt okay walking away from that scene tells you almost nothing about what actually happened inside your spine during impact. What happens structurally is this. When a vehicle strikes yours from behind, your head and neck get thrown backward and then snapped forward faster than your muscles can react. We call this whiplash. And the reason it is so deceptive is that the damage it causes is soft tissue damage. Muscles, ligaments, the small joints between your vertebrae. None of that shows up on a roadside assessment. You are not bleeding. You are not visibly broken. You feel shaken, but okay. And so you go home. Meanwhile, inflammation is building, not all at once, but gradually. The way a bruise darkens over the first 48 hours. By day 2 or 3, that inflammation has had time to accumulate, and now the signals your nervous system has been quietly trying to send start breaking through the noise. That is the stiff neck. That is the headache. That is the ache between your shoulder blades that makes it hard to sit at a desk. The exam is what actually tells you what's going on. When a patient comes in after an accident, we look at several things. Range of motion, which is how far you can turn, tilt, and flex without restriction or pain. Tender points, meaning the specific locations in the muscle and along the spine that are reacting. Nerve function, to rule out any signs that a disc is putting pressure on a nerve root. And joint mobility, how the individual segments of your cervical and upper thoracic spine are actually moving relative to each other. If everything checks out, I will tell you that. You leave with a clear picture and peace of mind, and that is worth the appointment on its own. But if something is off, and with whiplash we often find that it is, we explain it in plain language, not medical jargon, and we talk through what care actually makes sense for your specific situation. Not a generic protocol, your situation. Now, I want to mention something that matters practically, especially if you are here in Florida. Your personal injury protection coverage, what most people know as PIP, has a 14-day window. That means you have 14 days from the date of your accident to complete an initial evaluation with a qualified provider. If you miss that window, it does not just delay your care. It can affect your eligibility for benefits entirely. The insurance company does not call you to remind you. The clock just runs. We see patients come in on day 15th, day 20th, after waiting to see if the pain would go away on its own. And unfortunately, the coverage question becomes complicated in a way it didn't have to be. So if you were in an accident recently, even if you feel mostly okay, even if you think it was minor, the evaluation protects you in both directions. It either confirms you are fine or it catches something before it becomes a bigger problem. We keep same day and next day appointments available specifically for recently injured patients because we know that time is not abstract when your coverage has a deadline attached to it. And if you are more comfortable speaking in Spanish, we offer care natively in Spanish, in the office and on WhatsApp. You should never have to navigate something this important in a language that does not feel like yours. Here is what I want you to take away from this video. Feeling okay after a crash is not a diagnosis. Your body is good at protecting you from pain in the short term. And the structures most likely to be injured in a rear-end collision are the ones that won't announce themselves immediately. The pattern we see constantly is fine at the scene, stiff neck 2 days later, headaches by day 3. That is a clinical pattern we understand and know how to address. Get checked, not because we assume something is wrong, but because the only way to actually know is to look.